Hi, Mangere Bridge Whanau. I'm Kate. I live in the Bridge and I am so happy to be bringing up my little family here in this beautiful place. I'm a research fellow at the University of Auckland and I've got a PhD in clinical pharmacology from London. I've been doing medical research now for about 10 years and I study the things that make people get diabetes. Now, I know this is not infectious disease. I'm not a virologist or an epidemiologist. However, I do know numbers. Now, yesterday, somebody shared this newspaper page with us, and I wanted to break down some of the numbers on this, just in case anybody was a bit confused by what they were seeing. Overall, this article seems to be trying to make a point that lockdowns are too costly in terms of numbers based on this idea that COVID has quite low numbers of deaths. And they quote this number, 99.994% survival rate for COVID. But does their maths add up? This is the page we're talking about. So I'm just going to break down some of the important numbers in this. You can see that the 99.994% was actually circled by the person who shared this. So this is a key number that people are taking out of this. Most of the numbers are likely to be correct. Things like the population of Australia, yep, it's about 25 million people. They've got a really high testing rate, which is cool. The case numbers probably correct at the time that they printed, about 145,000. Of these, 143,994 recovered, although they don't see how many of these are having long-term effects and subsequent carrying on having illness. And 1,558 are dead. So most of them make sense, but there's a couple of numbers in here that don't make sense. One of these is that they calculate the death rate as being 0.69%. I don't even know how to make 0.69% out of the numbers they've given here. I think they just made that up. The death rate would actually be about 1%. So that's 1,558 is about 1% of 145,500. And this is an agreement with data coming from around the world. But one of the biggest issues with this article is that 99.994% survival rate. Now, this is really disingenuous. It's fake. They've used the entire population of Australia, the 25 million people, versus the number of deaths, 1558, to get this death rate of 0.006% or 99.994% survival. It completely doesn't make any sense to do this. For a few reasons, the entire population of Australia has not been exposed to COVID. So it's completely nonsensical. And this is especially because of lockdowns. They haven't all been exposed to COVID. Actually, you know, in reality, from everybody who catches COVID, about 1% of people die. In summary, this page has really just been designed to mislead. And it's been written by people who have an agenda to mislead. And I don't know what that agenda might be. Maybe they're lobbied by business groups who just want to get on and make some money and don't care about people's health. I'm not sure. It's designed to look factual whilst presenting fictional statistics. That's what I can say about this page. But while I'm here, I just wanted to say a couple more things about this particular subject. Why are populations around the world being locked down? And people are being forced to have vaccinations and so on, with the idea that we can go back to normal. Surely a 1% death rate doesn't look that bad. It's just like seasonal flu, right? It's something that you might hear quite frequently by people who are saying that lockdowns and public health measures are just not necessary. So I'm just going to try and put seasonal flu and COVID next to each other so you can get a bit of an idea between the two. Now, statistics for seasonal flu are released every year by the CDC and different countries in Europe. So this is the 2018-19 CDC season. This is the Center of Disease Control in the USA. So it's USA only data. 29 million people got flu in that season, which is actually about 8% of the United States population. 380,000 were hospitalized, which is somewhere between 1 and 1.5% of the cases. And about 28,000 people died, which is about 0.1% of the cases. Estimates of the global annual death rate from seasonal flu vary widely. It's really difficult to measure, but people estimate it ranges anywhere from 100,000 people up to about 500,000. Now, it's really hard to get data on COVID. that sort of matches up to this, because populations have been in different degrees of lockdown, different degrees of vaccination, hospitalization rates vary depending on the population that gets infected, i.e. Is there a big super spreader event in young people in a nightclub, or is it hitting, you know, old folks' homes in northern Italy? But the numbers that came out of China's population very early on in the COVID in early 2020 suggest hospitalization rates were about 10% of cases. And then about 1% of cases were dying. And since then, data from around the world has come in, and it's all been in about this ballpark. So let's look at New Zealand. So since January 2020, New Zealand has had 5,554 cases. 351 have been hospitalized, which is over 6% of cases. 28 deaths, which is 0.5% of cases. Now, like I said, the data that I can pull out gives a ballpark figure of about 10% of hospitalization for flu, which is, you know, if you go from 4% or 10%, that's still 4 or 10 times higher than the flu. Globally, death rates anywhere between 0.5 and 2. That's anywhere between 5 and 20 times higher than the flu. Global deaths from COVID since the beginning of 2020 have been estimated at about 5 million. Okay, and if you split that over 2 years, say it's 2 years, it's not 1 year, okay, that's still 2.5 million deaths per year, compared to maybe 500,000 maximum deaths per year from the flu. And these COVID cases, those numbers are with lockdowns. So it's really not just like the flu. So if anybody comes to you with that argument, you're really armed with the numbers now to show that it really isn't. And the key number that I saw early on that scared me was that 10%-ish hospitalization rate. Because if countries allow large numbers of COVID infections, it means you get a huge number of people needing hospital care. And it's a limited resource. So as soon as it gets exceeded, your death rates start going up, and that 1% death rate becomes 2% or worse. So how else can we get an idea of COVID impact from data that we find online? Now, there's a really good source of information online that you can go and have a look at yourself. The website's called Euromomo, and it's basically European mortality rates from a whole bunch of European countries that are lumped together. And they're plotted against what the average death rate is over the year. And this kind of gives you an idea of how many extra people are dying from, say, a bad flu season or COVID. So this is the data that they've got at the minute for a whole bunch of countries all pulled together. And you can see these blue peaks that go over the average rolling death rate. You see how it goes up and down a bit. That's with winter and summer. Death rates go up a bit in the winter. People die of infectious diseases. You can see the death rates kind of goes out of the average ranges on a few of these years where they've had quite bad flu seasons. And then if you go past 2020, you can see that these spikes are getting much bigger. And this is COVID, not flu. And you can see as well that that's including the lockdowns, which would have happened early 2020. You've still got big spikes for extra deaths above that would be expected. You can break it down by age groups as well. And you can see that in normal flu seasons, these peaks down here for the really old are much higher than the ones for the young people up here. And then when you have a look at 2020 and 2021, these spikes are quite big in all of the age groups here from 46 onwards, which is sort of matches what we know about COVID. So these are just some things that you can think about and look at if you're confused with the numbers that are being presented to you and you're not sure if the story that you're getting is the right story and the right information. If anybody has any more questions, you can give me a shout, no problem. Cheers for now, bye.